Hello, my name is Tess Allens. I'm a public health nurse from Stearns County Public Health. Today we are going to be talking about sexually transmitted diseases or sexually transmitted infections, otherwise known as STDs or STIs. First, we are going to start with a quiz to assess what you already know. You can just kind of shout out your answers. Question number 1, true or false? You can get chlamydia from a toilet seat. The answer? False. Chlamydia is only sexually transmitted. The bacteria that causes it can't live for long outside of the body, so you can't catch it from an object like a toilet seat or a towel. Question number 2, true or false? It is easy to tell if your partner has an STD. The answer? False. You might notice a rash, sore, redness, or something abnormal, or you may not. Just because there are not any visible signs, that does not mean that you are safe. People can have an STD and have no obvious symptoms. You will not know your partner's status unless they are tested. Question number 3, true or false? Sexually transmitted diseases are only contagious once you have symptoms. The answer? False. STDs can be contagious even when there are no symptoms. If you are sexually active, it is very important to get tested for STDs even if you don't have symptoms or if you have symptoms that seem unrelated. Question number 4, true or false? You can get an STD from giving or receiving oral sex. The answer? True. For example, if you're performing oral sex, it is actually possible to get chlamydia or gonorrhea in the throat. If you are receiving oral sex, you could get also genital herpes, which can be passed from contact with oral herpes. So the best way to avoid STI transmission through oral sex is to be sure to use a barrier, such as a condom or a dental dam, between the partner's mouth and the other partner's genitals. Last question, question number 5. True or false? Taking a shower or washing yourself after sexual contact will avoid an STD transmission. The answer? False. Do not rely on washing yourself after sexual contact to prevent the infection. That will not work. The best way to reduce your risk for STDs or STIs during sexual contact is to use barrier methods of protection, such as condoms, to prevent the transmission from ever happening. So why are we talking about this? Why does it matter? So more than 2 million cases of the 3 nationally reported STDs, chlamydia, gonorrhea, and syphilis, were reported in 2016 at their highest number ever. So from 2016 to 2017, the chlamydia rate increased by 4%. From 2016 to 2017, the rate of gonorrhea increased by 28%. And from 2016 to 2017, syphilis rates increased by 10%. So we are really seeing an epidemic right now of sexually transmitted diseases, which is why it's so important that we're talking about this right now. This is just another way of looking at the state of STDs in the United States and just how many cases there really are. So what can you do? So specific behaviors that reduce the chances of STDs include, number 1, avoidance of sex or abstinence. We realize that this is not always super realistic, so we're not going to talk about it today. Number 2 is reduction in the frequency of sex. Number 3 is the reduction in the number of sexual partners. Number 4 is correct and consistent use of condoms or other forms of contraception. And number 5, early detection and frequent screening of STDs. So the ones that we're really going to focus on is number 4 and number 5. We want to make sure that people are using barrier methods correctly. And we also really are going to talk about this a lot, that it is so important to get tested frequently and routinely. This is a graphic that just asks if you know your risk. So on the left-hand side, you will see that is the number of sexual partners that you have. On the right-hand side, That is the number of people you could have tentatively been exposed to if every person had the same number of partners as you. So you can see that if you have had one partner, they've had one partner, you've only been exposed to one person. But as you start to increase the number of sexual partners, you can see that the number of people that you're tentatively exposed to increases exponentially. So if you have had 7 sexual partners, it is possible that you could have been exposed to 127 people, even though you're not having sexual intercourse with 127 people, because of the exposures that are happening. That is how many people you could have been exposed to. So, the Medical Institute of Sexual Health identifies 27 STDs or STIs. We are not going to talk about all of them today. We are only going to talk about the ones that we have highlighted here. First, we are going to talk about HIV or human immunodeficiency virus. So, HIV or human immunodeficiency virus is the virus that causes AIDS. So, HIV can spread from person to person during vaginal, oral, or anal sex. That's going to be reoccurring, and the same with all these STDs, so I won't elaborate on that too much with the rest of them. HIV can also be spread while sharing needles or reusing equipment to inject drugs, tattoo, or body piercings. In the 1980s and 1990s, there was a big HIV scare about how HIV was transmitted. People with HIV were really becoming isolated because people didn't want to have any contact with them for fear that they would contract HIV. So we want to be very clear that HIV infection cannot be spread by social contacts, such as shaking hands, swimming pools, a social kiss, toilet seats, sharing cups or food, hugging, or coughing. So the following body fluids have been proven to spread HIV. So blood, semen, vaginal fluid, breast milk, or other bodily fluids containing blood all have the potential of spreading HIV. So I think there is a misconception about the difference between HIV and AIDS. So HIV is actually the virus that starts to weaken and attack the immune system. So over time, the infected people become very vulnerable to a variety of infections and cancers. So this stage of HIV, where the immune system is very low and not working like it should, that is when people get AIDS. So AIDS is actually not the virus. AIDS is the condition of your immune system not working as it should. Signs and symptoms of HIV. So early signs would be weeks to months after the exposure. So you would have flu-like illness or swollen lymph nodes. What happens then is later, years after the exposure, you can start to have persistent fevers, night sweats, prolonged diarrhea, unexplained weight loss, purple bumps on the skin or inside the mouth and nose, chronic fatigue, swollen lymph nodes, and recurrent respiratory infections. Something that's very important to note here is that these symptoms are really general and not specific for HIV. So most people with HIV will have no symptoms at all for several years, which is why it's so important to get tested. For example, if I have a flu-like illness or swollen lymph nodes, I'm not going to think that I have HIV. So again, so important to get routinely tested. There is no vaccine to prevent HIV infection, nor is there a cure. However, HIV is no longer a terminal illness, kind of like what we thought it used to be. It is now really looked as a chronic illness, more like diabetes, due to great advances in treatment. So HIV patients who seek early medical treatment and get started on antiviral medication can live very long, healthy lives. So what these antiviral medications do is they keep the virus from replicating as well as keeping your immune system healthy. There is actually a new campaign called U equals U, which stands for undetectable equals untransmittable. What that means is if HIV patients are taking their antiviral medications like they should every day as prescribed, That keeps the virus from replicating and keeps the viral number or the viral load very, very low. So you will always have HIV in your body. But if the virus number is so low because you're taking your antiviral medications and you can't detect it on a test, that means that you cannot transmit HIV. So again, if you have HIV, you always will have HIV. But if you're taking your medications properly and we can't detect the HIV virus on the test, you cannot transmit HIV. So that is kind of a really new, novel campaign that they're doing, which is awesome because it helps individuals with HIV really live pretty normal lives. Next, we are going to be talking about herpes. So herpes is an infection caused by two different but very closely related viruses. So herpes simplex 1 is also known as cold sores, and herpes simplex 2 is also known as genital herpes. So they're both in the same family but slightly different strains. So both are very easy to catch and they have very similar symptoms. Those blisters are the sores and can occur on different parts of the body. So for a long time, we kind of thought as herpes simplex type 1 or cold sores as above the belt and herpes simplex type 2 or genital herpes below the belt. But now that we're seeing increased oral sex, we're seeing both types in different areas of the body. So it's very important to keep an eye out for that. So genital herpes spread by vaginal, oral, anal sex, contact with infected lesions, or an infected mother to newborn. Something important to note here is that viral shedding can occur in the absence of blisters. So transmission is actually possible when when lesions are absent. And most transmission actually occurs in the absence of sores because people are not as vigilant as they are when they have the blisters. Signs and symptoms. So most people may never develop signs or symptoms or they're too mild to notice. However, if there are symptoms, they'll develop within 2 to 30 days or not at all. What you will get is small, painful, fluid-filled blisters on the genitals, mouth, or the anus. What happens is these blisters then progress to open sores that will crust over and heal within 1 to 2 weeks. Something important is that blisters can be hidden inside the vagina. A good thing, if you want to call it that, about herpes is that it's usually pretty painful, those blisters. So even if the blisters are hidden inside the vagina, you usually know that they are there. You will have itching, burning, or tingling on your skin in an area where blisters are about to appear. An initial infection can often be accompanied by fever, headache, and swollen lymph nodes. And blisters will go away, but the infection will always remain in the body. So there is no cure for herpes. It will always remain in your skin. There are treatments available to speed up the healing of the genital sores as well as decrease the frequency of the outbreaks. A very important note here as well, there are over-the-counter medications for cold sores. Those are not effective on genital herpes. So please talk to your doctor about the best treatment options for you based on the types of herpes that you have. So herpes is a lifelong infection which will have sporadic occurrences for the remainder of your life. Next, we are going to talk about the human papillomavirus, or HPV. So genital warts and HPV are the same thing, and this is actually the most common of all STDs. So there are actually more than 100 types of human papillomavirus, or HPV. About 30 types of HPV will affect the genital area. They actually estimate that 3 out of 4 sexually active people have some form of HPV, but most of them are those 70 types of HPV that aren't symptomatic, and so they clear pretty much on their own. There are another handful of types of HPV or strains that actually cause changes in cells and increase the risk of cervical and other types of cancer. So we'll talk about that in a minute. So genital warts is spread the same way vaginal, oral, or anal sex, contact with an infected person's warts, sometimes an infected mother to newborn. And warts and HPV can be spread even if no warts are visible because the virus can be present on areas not protected by a condom. So there is an HPV vaccine, which is recommended for routine vaccination around 11 or 12 years, but we can start vaccinating down to 9 years of age. So the ACIP, which is the immunization kind of board, also recommends vaccination for females 13 to 26 and males 13 to 21 who haven't been vaccinated. So if you're within that age group and you haven't been vaccinated, you are still able to become vaccinated for HPV. They also had a campaign for a long time for HPV that talked about HPV being a sexually transmitted disease. A lot of parents who are vaccinating their kids at 11 or 12 years didn't like the idea of their children being sexually active. So what they had to do was kind of change the campaign so that the HPV vaccine really focuses on cancer prevention. So the HPV vaccine truly is a cancer preventing disease, and we really want to encourage parents to give that to their kids because even if they're not sexually active when they receive the vaccine, it can prevent STD transmission and it can make sure that they are at lower risk of getting cancer. Signs and symptoms. So most people will have no symptoms, but if there are symptoms, they will develop within weeks or months after the exposure or not at all. You will get soft, fleshy lumps on or near the genitals or the anus. So unlike herpes, the soft, fleshy lumps for genital warts are usually not very painful, and so they could be hidden inside the vagina or anus, and people could not know that they have them. You could have itching or burning around the genitals. The warts may go away with treatment, but the HPV infection will persist. And in 90% of cases, HPV will actually disappear spontaneously within 2 years after infection. So the body will kind of clear it on its own. There is no cure for genital warts. The virus will remain in your skin for the rest of your life. There are treatments to help remove the visible warts. Very, very important here. Treatments used for other types of warts will not work on genital warts and are harmful. Please do not use over-the-counter treatments to freeze off warts or for planters warts on genital warts. They are not effective and can cause serious damage to the genital area. So please, please do not do that. Talk to your doctor. Treatment from your doctor will decrease the amount of warts that you have and make it less transmissible. Next, we are going to talk about hepatitis. There are several different types of hepatitis. Today, we're going to focus on hepatitis B, since this is sexually transmitted, and then we're also going to touch on hepatitis C, which is transmitted via blood. So hepatitis B is a virus that causes disease in the liver, and all of the hepatitises actually are viruses that cause disease in the liver. So what happens is the virus will damage the liver over time and lead to cirrhosis, and cirrhosis is just scarring of the liver. So I'm sure that you guys have heard of cirrhosis for other things, but that just means scarring of the liver, which can lead to liver cancer and ultimately death. Hepatitis B transmission happens from unprotected sex, sharing needles for injecting drugs, body piercings, or tattooing, infected mother to newborn, or sharing personal items that could have blood or bodily fluids on them, such as razors, toothbrushes, nail clippers, or pierced earrings. Something very, very important about hepatitis B, unlike most STDs, the hepatitis virus can live outside of the human body for up to 30 days. So this is really unusual for a virus or a bacteria. Most of them need a human host. Hepatitis B is a pretty hardy virus, which means that if you share a razor and there's a little bit of blood on it, and somebody else uses it 2 weeks later, there is a chance that you still could be transmitting hepatitis B. So very important. Signs and symptoms of all hepatitises are fatigue, unusual fatigue, poor appetite, nausea and or vomiting, intermittent fever, stomach pain or pain where your liver is. And for those who don't know where your liver is kind of on the upper right-hand side of your abdomen. Very dark, concentrated yellow urine, light-colored stools, jaundice, which is yellowing of the skin and the eyes. And these can begin 45 to 180 days after the exposure. Prevention for hepatitis B. So there actually is a hepatitis B vaccine. So you get a birth dose right when a baby is born, and then you'll get the other 2 doses over the next 6 months. That is the best form of protection that somebody can get. If you have not received this vaccine and if you are sexually active, it is still recommended to receive this vaccine. Another prevention is using latex condoms during vaginal, oral, or anal sex, limiting the number of sex partners, not sharing personal items, vaccinating pregnant women and newborn babies, and if you have had unprotected sex and have not been vaccinated, again, testing and immunization, getting immunized is recommended. Next, we're going to talk about hepatitis C. So hepatitis C is a bloodborne disease that people can live with for years without knowing it and without having any symptoms. So hepatitis C virus is transmitted through contact with infected blood. So prior to 1992, they would not check blood that was used for blood transfusions in hospitals for hepatitis or for other diseases. And so if you've had a blood transfusion prior to 1992, it is very highly recommended that you get tested for hepatitis C. Another way that it can be transmitted is shared IV drug needles or syringes, contaminated tattoo needles. So if hepatitis is left untreated, it will cause damage to the liver, again, the cirrhosis, lead to cancer, and then even death. Something that surprises me every time I read about hepatitis C is that each year more people die from hepatitis C than HIV. This is because people aren't getting tested. It's a disease, again, that people can live up to for years and years without any symptoms. So very important to get tested. However, there is a cure for hepatitis C. So today's treatment has about a 95% effective cure rate. This is really important. We don't have a lot of cures for viruses, so it's kind of really on the forefront of medicine that we actually have a cure for hepatitis C. And the fact that we have a cure for hepatitis C, but more people are still dying from hepatitis C than HIV, these deaths are totally preventable as long as people are getting tested. So prevention, there is no vaccine for hepatitis C like there is for hepatitis B. So be sure to avoid contact with other people's blood. And we are not condoning drug use, but there is a needle and syringe exchange program. For this area, it's located at the Rural AIDS Action Network. You don't have to have AIDS to go there or exchange needles. It's a safe place where we can make sure that we're not transmitting disease. So if you have friends, please tell them about this program. Something that we've also heard about hepatitis C, a rumor or a myth, is that if somebody uses and they have dried blood on the needle and then reuse with that dried blood on there, that you can contract hepatitis C that way. If you do not have hepatitis C and nobody else has used that, there's no chance that hepatitis C could have come up on that blood or kind of manifested on the needle. Obviously, it's not good to put that dried blood back in your body, but you cannot contract hepatitis C that way. Next, we are going to be talking about chlamydia. So chlamydia is actually the most commonly reported bacterial STD in Minnesota and in the United States. So you can see these are 2017 Minnesota chlamydia rates by county. So this is an actual number of cases. This is rates, case rate per county. So you can see that in the middle of the map, you'll see Stearns County. That's where you're located right now. That's the St. Cloud area. If you go a little bit down and to the right, that cluster of dark purple is the Twin Cities. So you can kind of see where you're from based on that. The darker colors have higher rates, and you can see that there is quite a few cases currently in Minnesota. Chlamydia is spread by vaginal, oral, anal sex or infected mother to newborn. If left untreated, chlamydia can actually cause infertility for men and women. Sometimes only one partner will have symptoms, even though both have the disease, which is why it is so important to notify your sexual partners about the results of your test. Chlamydia is actually known as the silent STD because most people have no symptoms. This is why chlamydia is spreading so quickly throughout Minnesota and the United States. If they do develop symptoms, they will happen 7 to 21 days after the exposure. For women, they will have some abnormal vaginal bleeding or discharge, burning or pain during urination, pain in the lower abdomen, or anal discomfort. For men, some of the symptoms will be watery or very thin white discharge from the penis, burning or pain during urination, and anal discomfort. However, chlamydia is totally curable with antibiotics, but if it is left untreated, chlamydia can lead to permanent scarring and damage to the genitourinary tract. What will happen is that can lead to infertility in both men and women. So you can see in this picture that's some of the scarring that occurs. That a really swollen thing on the right hand side, that's a fallopian tube. So that could be a result of untreated chlamydia. Next, we are going to be talking about gonorrhea. Gonorrhea is also known as the clap or the drip. And a fun fact for you, gonorrhea is known as the clap because it is usually involves a lot of pus in the male penis. And so what they used to do back in the olden days to cure gonorrhea is they thought by expelling all of the pus at one time that would cure gonorrhea. So they would actually clap their hands around the penis or a book around the penis very hard to try and expel all of that pus at once. So very painful. It's good that we're not using that treatment method anymore, but that is why gonorrhea was originally called the clap. Fun fact for you. Gonorrhea is spread by vaginal, oral, anal sex or infected mother to newborn. Again, you can see 2017 Minnesota gonorrhea rates by county. Stearns County or St. Cloud is again in the middle of the map there. So you can see rates based on the county where you are from. Signs and symptoms of gonorrhea. They can be mild or absent, especially in women. If they do happen, they will usually begin 2 to 7 days after the exposure. For women, you will have abnormal vaginal bleeding, discharge or itching, burning or pain during urination or bowel movement, more pain than usual during your periods, cramps and pain in the lower abdomen, anal discomfort, itching or discharge. And for men, the signs and symptoms include thick white or yellow discharge or pus from the penis, burning or pain during urination or bowel movement, and anal discomfort, itching, or discharge. Again, gonorrhea is totally curable using medication provided from your medical doctor. And if gonorrhea infection persists for a long time without being cured or tested, there can be permanent damage, which again can lead to infertility in both men and women. We are also seeing a growing number of antibiotic resistant gonorrhea cases, which is making treatment really difficult. We want to prevent this by if you get a course of antibiotics to cure anything, including gonorrhea, take the full course. Do not stop after the treatment or the after the symptoms have stopped, that is when we're seeing the antibiotic resistance. So just be on the lookout for that and make sure that you're taking your antibiotics correctly. Next, we are going to be talking about syphilis. Syphilis is called the great imitator because there are so many signs and symptoms that are similar to other diseases. So a person can have syphilis and not even know it. Spread by vaginal, oral, anal sex or infected mother to newborn. Again, 2017 Minnesota primary and secondary syphilis rates by county. We'll talk about primary and secondary syphilis here in a minute. Stearns County in the middle. Signs and symptoms. So syphilis occurs in 3 stages. The first stage is known as primary syphilis. Symptoms will begin 1 to 12 weeks after the exposure. What will happen is you will get a painless open sore on the mouth, genitals, or anus. Most people do not think that this is anything extraordinary because it's painless. Most people do not seek a doctor to see what's going on. Sometimes these sores can be hidden inside the vagina or the rectum. They can last 1 to 5 weeks, and then the sore will go away. But what happens is syphilis will remain in the blood. Then, if it is not cured at that point, you will move into second stage syphilis or secondary syphilis. These symptoms will show up anywhere 6 weeks to 6 months after the sore appears and disappears. You will start to get a rash anywhere on your body. You'll start to have some flu-like symptoms and start to get whitish gray patches on the mouth or lips or wart-like lesions around the genitals, and also can actually experience hair loss. Again, totally curable at this point, but most people do not think that a rash or flu-like symptoms are syphilis. They think that they're other things, so they don't seek treatment or don't seek advice from their medical doctor. If it is untreated at that point, it will move into third stage or latent syphilis. So you don't have any outward appearances or outward symptoms of syphilis, so no sores or rashes, but syphilis will actually still remain in the blood and starts to permanently damage the heart, brain, and other organs over time. So back in the olden days, I'm sure that some of you have heard about people going crazy from syphilis. What would happen is it would go untreated for a very long time. They would move into third stage or latent syphilis and start to have permanent damage to their brain, which would cause them to kind of go crazy. So again, syphilis is totally curable using medication prescribed by a medical provider. So do not let it get to permanent damage. It can occur in stages that happen for weeks, months, or even years. Next, we are going to talk about pubic lice. So pubic lice is also known as crabs. This is an infestation of parasites that will attach themselves to the pubic hair or other coarse hair. So crabs actually come from the same family as head lice, but they are not the same thing. They're kind of like cousins. Pubic lice can be cured with medicated shampoos and creams. Very important. Pubic lice is spread a little bit differently. So it's spread by sexual contact, but this can also be spread by close physical contact, infested towels, bedding, and clothing, which is very different than other STDs. However, even despite this, transmission from toilet seats is unlikely just because of the location of where they typically hang out is not something that comes in contact with the toilet seat. So something important to remember that they can be transmitted, unlike other STDs, from infected towels, bedding, and clothing. So signs and symptoms include severe itching, and sometimes you will actually see the lice moving around in hairy parts of the body or on those towels, bedding, or clothing. Last, we are going to talk about trichomoniasis. So trichomoniasis is actually the most common curable STD in young sexually active women. So there are an estimated 5 million cases each year in the US in women and men, which makes it more common than chlamydia and gonorrhea. Totally curable using a medication prescribed by a medical provider. We think that it is so common, but it goes untreated so often just because it really mimics like a yeast infection. So for women, some signs and symptoms. Some women will have no symptoms, but if they do, they'll happen 5 to 28 days after the exposure. Start to have itching, burning, or pain in the vagina. Frothy yellow-green discharge with maybe a foul odor. For men, most men are asymptomatic or don't have any symptoms with trichomoniasis. If they do have any, it'll be mild discharge from the penis or pain after urination or ejaculation. So, moral of the story, STDs are totally preventable. So, as long as you have correct and consistent condom use, reduce the number of sexual partners, delay the start of sexual activity, not share needles, and see a doctor for a checkup and testing at least once a year or more frequently if you have no condom use or if the condom breaks, if your partner has an STD or an STI, if the partner is having sex with someone else, injected drug use, if you've been raped, or if you have any signs or symptoms of an STI. So please, please, please get tested at least annually. It can really stop some of these unnecessary long-term effects of untreated STDs or STIs. So we want to stop this epidemic and spread of STDs by talking about it with people, which is why we're talking about it today with you. So talk about it with your partners, talk about it with your doctors, talk about it with other people. Get tested. It is the only way to know if you have an STD. Don't just guess or based on your signs and symptoms. Be sure to get tested and get treated if you can. If you can't cure the disease or the virus, then at least get symptom treatment. So work with your provider to get the correct medicine. Something that's really important, I think a lot of people think they know how to put on a condom correctly, but just to review, the correct way to put on and take off a male condom. So make sure to place a condom on the head of an erect penis. If it's not erect, it won't fit correctly. It can cause sliding and won't cause as much protection as it can. Pinch the air out of the tip of the condom and then unroll the condom all the way down. Very important thing that most people don't do after sex, but before pulling out, make sure to hold the condom at the base and then pull out. What happens oftentimes is because the penis is no longer erect, it will slide off and basically undo everything that you just worked so hard to protect yourself against. So please hold the condom base before pulling out, and then be sure to remove the condom and throw it away in the trash. Some do's and don'ts of condoms. There's a lot of information here, but the most important ones here is do not store condoms in your wallet. Heat and friction can actually damage them and basically render them useless. Also, do not use oil-based products like baby oil, lotion, petroleum jelly, or cooking oil as lubricant because this causes breakage in the condom and will again render it useless. Also, sounds silly, but do not use more than one condom at a time, and please do not reuse a condom. In the St. Cloud area, there are 2 clinics that can provide low-cost or free STD testing, in addition just to going to see your medical provider. So you can go visit Planned Parenthood. You can call and make an appointment. They have low-cost STD testing. They also have a sliding fee based on your income. If you want free STD testing, you can go to the Pregnancy Resource Center. This is for men and women. You can call or text to make an appointment there. If you're not from this area, what you can do is call the number on the left-hand side for the Minnesota Family Planning and STD Hotline. You can always just look up Minnesota STD Hotline and call that number. What that will do is they can tell you places in your area where there are low cost or no cost STD testing. So if you need that information, the phone number is 1-800-783-2287. If you have any questions, please reach out to Stearns County Public Health or talk with the staff there. Thank you very much, and I hope you have a wonderful day.